People ask me this question and they're sort of surprised when they hear about the statistics because pancreatic cancer just became the third leading cause of cancer-related deaths. And it's predicted by the Pancreatic Cancer Action Network that in 2020 it's going to become the second leading cause of deaths. Now, roughly 50,000 people get diagnosed with it, and I don't know the exact numbers, but I think it's over a 250,000 get diagnosed with breast cancer. And their outcomes are much better. Again, I have nothing against breast cancer. I have nothing. I'll walk. I support people who do Komen and et cetera, and I'm happy to see the pink. But what they have as an advantage is that there's mothers and daughters and sisters, and of course some men get affected by it. They're able to actually get upset, get treatment, and actually get cured, or at least live for 10, 15, 20 years. And so if you go through the Psych 101 on that, you get angry, get upset, but then you're actually really elated and excited, whether it's a family member or yourself, that like, hey, here's a cure. My father had lymphoma, and he's basically cured from it. Now, personally speaking, I have very good feelings about the lymphoma field, that they do this. And so if I want to donate some money to someone came to me and asked me to donate money or advocate for it, I would. Pancreatic cancer has a different situation. Unfortunately, the patients and their families really only have time to be angry. And I don't blame a lot of them if at the end of the day they want to move on. We have a very loyal population here, and I think it says a lot about our clinicians here as well as our researchers, that a lot of the patients, even if our family members, even if we do the best we can and they extend their life, if some of them unfortunately succumb to the disease, we have a lot of loyal people who stay in touch with us, come to our patient symposium, want to give back and donate because they realize that's the way to continue their legacy. I'm not putting anyone down if they were touched by pancreatic cancer and they're just basically upset with it and they need to move on, and there's no judgment there. But we seem to have a very unique population that seem very grateful for what we've done for them. Unfortunately, we don't have the population, as I mentioned, with the breast people or even the prostate people. I think Pancreatic Cancer Action Network as an organization, and we support them and they support us, we've gotten 2 grants from them, do an excellent job. In fact, I think this week is Advocacy Week down in Capitol Hill, and I've done that where you go down and you meet with the senators and the congressmen and their staff, and you try to educate them, and they're very surprised when they realize that only a small percentage of the National Cancer Institute dollars actually go to pancreatic cancer, but a lot go to breast and prostate. And I don't want to editorialize too much about the government, but the more people you have and the more money behind you, the more lobbying you get, and that makes sense, and in part that's democracy. It's a passionate subculture of people who are affected by it. And as a researcher here at Jefferson, we work very hard to try to figure this out. It's a great intellectual challenge, but I constantly feel like we're behind, because every patient that we lose is just a reminder to us that we need to work harder.